So injectables, botulinum toxins, the number one non-surgical procedure that's done for aesthetic treatments throughout the world, and it's very well accepted. There's not many patients who come in and say that they didn't appreciate having botulinum toxin, and can be started at all sorts of different ages. We always like to assess our patients first to see where the main indications for the botulinum toxin are in form of a cosmetic consult, and make sure that we're addressing the face as a whole, not just an upper third of face or the frown lines or a specific area that they think they've got a problem. We like to see wherever on that face there's an ageing concern, what can we do to help with botulinum toxin. It's a quick and easy procedure. It takes about 15 to 20 minutes to perform, and patients can walk out without any major bruising or any evidence that they've had any procedure done. So ideal treatments start with when you're looking at ageing concerns. Our average age of patients is around their 40s probably, but we have patients who also have botulinum toxin for other indications as well, including sort of migraine treatment, for teeth grinding and thickening of your masseter muscles in your face, and for underarm sweating. So there's lots of different indications we're noticing that botulinum toxin can improve, and it's an ever expanding science.